As healthcare expenses continue to rise, many older adults are left wondering how they'll afford the basics: doctor visits, prescriptions, and premiums. If you rely on Medicare, you already know it doesn't cover everything. Even small monthly costs can add up quickly on a fixed income. But what if there was a little-known way to cut down those expenses without changing your coverage or switching doctors? In today's video, we're going to take a closer look at Medicare savings programs. We will discuss types of Medicare savings programs, the monthly income and resource limits, and steps to apply for Medicare savings programs. So if you want to learn how to lower your Medicare premiums, visit quote.com. Just type your zip code into our free comparison tool to compare quotes and explore Medicare plans that work for your budget. Easy and stress-free. To start, let's make sure we fully understand what Medicare savings programs actually are and how they work. Medicare Savings Programs, or MSPs, are state-run assistance programs that help pay for Medicare-related costs. That includes your Part A, or hospital insurance, and Part B, or medical insurance, and in some cases, even deductibles, co-payments, and co-insurance. These programs are especially helpful because they act as a financial safety net for people who need Medicare but can't afford its full price tag. Think of it as Medicare support for people who don't qualify for full Medicaid coverage. If you're struggling to keep up with your monthly premiums or skipping appointments because of cost, MSPs could offer real financial relief. Medicare can get expensive, but that's where Medicare savings programs come in. These state-run programs can help cover your costs if you meet certain income and resource limits. Want to check what rates you might qualify for through a Medicare savings program? Head over to quote.com and use our free comparison tool to see insurance rates from different providers and find out what you're eligible for and how much you could save in just minutes. Now that we've covered the basics, let's break down the 4 types of Medicare savings programs and what each one actually covers. First, there's the Qualified Medicare Beneficiary Program, or QMB. This is the most comprehensive of the 4. It helps cover your Part A and Part B premiums, along with deductibles, co-insurance, and co-payments, meaning you could pay almost nothing out of pocket for covered services. Next is the Specified Low-Income Medicare Beneficiary Program, known as SLMB. While not as broad as QMB, it still helps by covering your monthly Part B premium. It might not seem like a lot, but they offer $174 a month, or over $2,000 a year in savings. Another option is the Qualifying Individual Program, or QI. QI is similar to SLMB and also helps with the Part B premium, but there's limited funding. It's awarded on a first-come, first-served basis, and you'll need to reapply each year to keep your coverage. Finally, there's the Qualified Disabled and Working Individual Program, called QDWI. This is specifically for people under 65 with a disability who returned to work and lost their free Part A. QDWI helps pay for that Part A premium, so you can keep your job without losing essential Medicare coverage. Each of these programs has different requirements, but all of them are designed to make Medicare more affordable for people who qualify. To learn how a Medicare savings program can impact your rates, visit quote.com and enter your zip code into our free comparison tool to view insurance quotes and find out which provider best fits your budget. Now that you know what each Medicare savings program covers, let's talk about something just as important: how to qualify. Eligibility is based on 2 main things: your monthly income and the value of your resources, like savings, stocks, or bonds. Each program has its own limits, and sometimes even a small income difference can affect which one you qualify for. First, let's start with QMB, the program that offers the most coverage. To qualify, your monthly income limit must be no more than $1,275 per individual or $1,724 for married couples. Your resource limit must also fall below $9,430 for an individual and $14,130 for married couples. Because it covers premiums, deductibles, and more, QMB has the strictest financial limits. Next is SLMB, which offers a little more flexibility with income. Your monthly income limit must be $1,526 per month as an individual or $2,064 for married couples to qualify. The resource limits are the same as QMB, $9,430 for an individual and $14,130 for married couples. SLMB is a good fit for people who need help with premiums but don't meet the tighter QMB thresholds. Then there's QI, a program with the highest income limit for Part B premium help. You can qualify with up to $1,715 in monthly income limit per individual, or $2,320 for married couples. Resource limits match QMB and SLMB, with $9,430 for an individual and $14,130 for married couples. QI is offered on a first-come, first-served basis, and you must reapply each year to keep receiving help. Finally, we have QDWI, which is designed for working individuals with disabilities. To qualify, your monthly income must be $5,105 per month for an individual or $6,899 for married couples. However, resource limits are lower than the other programs: $4,000 per individual and $6,000 for married couples. This program helps people who returned to work and lost their Free Part A continue to get affordable coverage. These income and resource limits can change yearly, so always double-check the most recent numbers before applying. Staying informed gives you the best chance to get the help you need. Want to know more about which program you might qualify for? Head over to quote.com and use our free comparison tool to compare quotes and see which insurance providers best suit your Medicare needs and budget based on your area. Once you know you qualify, the next step is figuring out how to apply. And thankfully, it's easier than many people think. Here are the 3 steps you can follow to apply with confidence. First step, confirm your eligibility by reviewing the program requirements. Make sure your income and resource levels fall within the limits for the program you're applying to. This step ensures you're not applying for a program you don't qualify for, saving time and effort. Second step, complete the application form with the required information. You can access it online or pick up a physical copy at your local Medicaid office. You'll need to provide your Social Security number, proof of income, and documentation that verifies your residency. Finally, our third step, submit your application through your preferred method. Some states let you apply online, while others accept in-person, mailed, or even scanned document submissions. Make sure to include all supporting paperwork to avoid delays. Applying for a Medicare savings program may take a bit of preparation, but it's a straightforward process once you know the steps. With the right documents and support, you could unlock significant savings on your healthcare costs. Learn more about your Medicare savings program options by visiting quote.com. Use our free comparison tool to check your quotes from different insurers in your area and find the best fit for your needs, all in one place. Medicare savings programs can make a big difference for those on a fixed income by reducing or even eliminating costly premiums and out-of-pocket expenses. If you think you might qualify, taking the time to apply could lead to major savings and better healthcare access. If you found this video helpful, give it a like to let us know. Doing so allows us to make more content like this. Share your experiences or questions about applying for MSPs in the comments. Your insight could help someone who's just starting the process. And subscribe to our channel for more guidance on saving money and navigating your insurance options. Always remember, every dollar you save on healthcare is a dollar you can use to live better. Thanks for watching, and see you at the next video.